Hello friends. Welcome to Being Parents. Today we will learn about newborn care. Being a parent of a newborn brings infinite joy and a sense of responsibility. It is very difficult for new parents to understand the various requirements of the newborn. Miscellaneous information provided by friends and online articles enhances confusion. Here we are providing reliable answers to all your questions and questions related to newborn care. How to handle a newborn baby. 1. Wash your hands, or at least use a hand sanitizer before handling a newborn. Newborns are more susceptible to infection due to immature immune system. Make sure everyone who is caring for a newborn baby has clean hands. 2. Support the head and neck of the child carefully. Babies do not have neck control, so when you lift the baby, keep it straight or lay it upright. 3. Do not shake the newborn baby hard. Shaking the baby vigorously can lead to bleeding inside the brain and even death. If you need to wake up your baby, gently pinch it with a finger on the cheek or tickle its feet. What are the different ways to catch a newborn? Snuggle hold. The baby's head and chest will be attached to the mother's lower shoulder, as shown in the figure. Support the neck with one hand and support the buttock with the other hand. Keep the head aside so that the child can breathe. Benefits of this condition. The child feels safe and can hear the heartbeat of the mother. Face-to-face hold. Support the baby's head and neck with one hand, as shown in the picture. With the other hand, the child can be supported around the waist or the baby can be seated on lap. In this situation, it is easy to interact with the child. Cradle hold. In this situation, the baby's head and neck are supported by your forearm and arm, as shown in the picture. The other hand can be used to care for or feed a newborn. We can take back support to avoid back and shoulder stretch. How to swaddle your baby. Spread the fabric and fold a corner as shown in the figure. Lay the head of the child on top of the folded corner. Bring the bottom corner over the child's feet. The hips and knees should be slightly bent. Do not wrap the baby too tightly around the hip. This may increase the likelihood of hip dysplasia. Wrap the right corner around the child and stick it under the child's back to the left. Wrap the left corner around the child's right so that only the neck and head are outside the blanket. Do not wrap the baby too tightly. Make sure that you can easily move the fingers between the blanket and your baby's chest, which is necessary for comfortable breathing. However, make sure that the blanket is not loose enough to unfold. Babies should not be wrapped in clothes after the age of 2 months. At this age, some children can turn on side when swaddled, which increases the chances of smothering. How to get a newborn to burp. 1. Keep the baby upright on your shoulder to support the neck and head. Hold the child around her hip with one hand. Gently pat the back with the other hand. This situation can be difficult for a child of very small size. 2. Keep your baby lying on his stomach. Support his face with one hand as shown in the picture. Make sure the head is above chest level. Gently pat the back with the other hand. 3. Make your child sit on your lap. Hold the baby's jaw with thumb and fingers and rest the soft padded portion of your hand on the child's chest. Take care not to pressure the baby's throat. Use the other hand to gently pat the child's back. This technique is good for a child of small size. What may be the reasons for the newborn's constant crying? Babies can express their needs only by crying. Crying can be due to hunger. This may be due to pain or it may be just because the child feels alone. We can try to find out what could be the reason. 1. Wet diaper. Check if the diaper needs to be changed or adjusted. 2. Is there a need of burp? Use a different method for burp. 3. Stomach gas. Lying your baby on his back, rotate his legs and hips up and down as if he is riding a bicycle. 4. Physical discomfort. Is the child too hot or cold? Is there any irritation to baby due to scratchy labels or buttons of clothes? Blocked nose due to secretions can irritate a child. Try to clear the blocked nose by using saline nasal drop. 5. Feeling lonely. If the child wakes up and no one is around, then he can cry for someone and just want you to pick him up. 4. Hunger. Try to feed the baby. See if he stops crying or not. 4. Fever. The temperature of the child can be checked with a thermometer on the forehead. If it is high, paracetamol may be given. Dose of paracetamol can be confirmed with your pediatrician. 4. Baby want to sleep. Check if the child is sleepy. If so, Make proper arrangements for the baby to sleep. 10. Too much stimulus. Some children may be unusually sensitive to touch, light, or sound and cry easily. If this is the case with your child, keep noise and light levels low. What can be done to calm a crying newborn? 1. Honey nipple. Not all children are pacified by the honey nipples. Many doctors do not recommend their use. But they can certainly work wonders for some infants. If the child falls asleep, do not put it back to the child's mouth. 2. Swing. Manual or motorized swinging may work for some infants. 3. Swaddle. Babies wrapped with clothes. It reminds them of being back in the womb. Do not try this if the child is more than 3 months old. 4. Start the vacuum cleaner. The baby inside the womb is constantly surrounded by noise. Running a vacuum mimics that type of noise and can comfort your child. Running a vacuum next to a child can be surprisingly effective. 5. Voice and music. Babies usually like music. You can sing nursery rhymes or read them loudly. Light music can be useful for some babies. If the above things do not work and the infant continues to cry without any reason, or if it cries aloud, then consult your pediatrician. Remember that a loud cry without reason can be a sign of danger and requires a checkup from a doctor. Sometimes ear pain, abdominal discomfort or torsion of testis or ovary may be a reason for unconsolable cry. These are emergencies and require immediate treatment. Newborn sleeping patterns. My baby is a few days old. He sleeps all the time. Is this normal? Yes, newborns can sleep up to 16 hours per day. The newborn's stomach capacity is so low that he needs milk every few hours. Infants should be awakened if they did not feed for more than 4 hours. If the child urinates more than 6 times a day, this means that he took enough milk. Can I use the crib for a newborn? Yes. The crib should be readily available in the mother's room. Some doctors recommend sleeping the mother and child in the same bed. It also helps in bonding, developing milk production and keeping the baby warm. Before the mother sleeps, the baby should be kept in the cradle. Sometimes if the mother and the infant sleep in the same bed, it may cause suffocation by accidentally pressing the child's nose. Why should we put babies on their backs? What's wrong if baby sleeps on his tummy? It is necessary to place children on their backs to sleep, so as to reduce the risk of SIDS, sudden infant death syndrome. In addition, remove all very soft bedding, cushions and soft toys from the crib to ensure that the child does not get entangled in them or suffocated. Be sure to place it on a different side, first right and then left, every night so that the side of the head is not flat. Immediately after feeding, make the baby burp and lie on the left side. This will help reduce vomiting of milk. When can I expect my baby to sleep overnight? Most children sleep at night, 4 to 6 hours, at 3 months of age. But if your child is not so, it is not a cause for concern. Every baby has its own sleeping pattern and sleeping cycle. Why do some children stay awake and alert at night and sleep during the day? Every baby has its own sleeping pattern and sleeping cycle. One way to help them sleep early in night is to keep the excitement at night to a minimum. Keep the lights low. Try to keep him awake a bit longer by talking and playing during the day. Adjust according to his sleeping pattern. When your baby is sleeping, you should also rest. What kind of cloth should be used for a newborn? Loose cotton clothes are best for the Indian environment and are skin friendly. Synthetic clothing can cause rash. In winter, woolen clothes can be worn over cotton clothes. The infant should neither be overcovered nor undercovered. Covering more clothes will cause fever and covering with less clothes will cool the baby. Children cannot produce sweat and therefore are not efficient at controlling their body temperature effectively. Just give the child a layer of cloth extra. If you are comfortable with 2 layers of fabric, give it 3 layers. Clothes should be free of scratchy labels and buttons that may irritate the child. My baby has nappy rash. What should I do? Rash around the waist called nappy rash is caused by prolonged exposure to the skin with a wet cloth. Using cotton cloth to prepare the nappies and changing the nappies repeatedly when wet can prevent rashes. If your child has already got rashes, keep the child without diapers for a few hours a day. The cream available in the market for nappy rash can be tried in mild cases. More severe rashes require evaluation and medication from a pediatrician. Should we apply oil to a small soft part of the baby's scalp called a fontanelle? Fontanelle is a gap between the bones of the skull that provides space for the rapidly developing brain of the newborn. It closes automatically at the appropriate time, usually between 12 and 18 months of age. Applying oil will not change this process. My baby is a few days old and looks a little yellow. Is it worrying? All children develop a yellow color of the eyes and skin, called as jaundice, during the first few days of life. This is called as common jaundice or physiological jaundice. If the jaundice level rises rapidly, the child may require treatment in the form of phototherapy. Consult your pediatrician. If the jaundice level is low, there is no need to worry. Jaundice usually aggravates in the first week of life, and it is reduced later. Read the section on jaundice in newborns in Being Parents online for details. My baby cries while urinating. Does she have urinary tract infection? The newborn can make the first urine at any time within the first 48 hours of life. The baby may urinate irregularly for the first few days. Once a baby starts consuming breast milk well, it usually urinates more than 6 times a day. Crying before and after urination is a normal occurrence and does not require a checkup. The child cries with the sensation of urination before urination and later due to wet clothes. My baby vomits between feeds. Do we have to consult a doctor? Babies usually swallow air during feeding and it causes vomiting after belching or between feeds. Vomiting can be milky or curd-like. This is a normal phenomenon. If the child is gaining weight normally, there is no need to worry. If vomiting occurs repeatedly, is yellow, if baby is losing weight or abdomen is distended, consult your pediatrician immediately. My baby is a few days old and has loose motions constantly. Does she need treatment? The child must pass first stool within 24 hours of birth. If not, the rectum should be examined by a pediatrician. During the first few days of life, stool color in newborns changes from black to green to yellow by the end of the first week. The lactating baby may have frequent, golden yellow, granulated feces. A loose stool appears in the middle, called as transition stool. At this time the frequency of feces may increase. Due to the gastrocolic reflex, the baby makes small stools immediately after feeding. If the child is active, urinating 6 to 8 times per day and gaining weight, it is not a cause for concern. It should be noted that a healthy newborn may not pass stool for 2 to 3 days. If the child is not vomiting and the stomach is soft, this should not be a concern. My child sneezes and coughs several times a day. Do I need to see a doctor? Sneezing, cough, hiccups and yawning are common in newborns. In some healthy newborns, there may be a mild sound while taking a breath. Sometimes the child breathes rapidly for a few seconds. This is a normal phenomenon. If the baby has difficulty feeding, then consult your pediatrician. I have a newborn baby girl. She has white, red vaginal discharge. We are worried. What should we do? Vaginal discharge, red or white, of the female newborn may occur under the hormonal influence of the mother. No need to worry. If the bleeding persists for some time or if it increases, consult your pediatrician. Is it appropriate to add honey, gripe water or dry fruit to the newborn? No. This can cause serious infections in infants and should be avoided. Mother's milk is sufficient and in the first 6 months of life, the baby does not need anything else. Is it okay to use kajal or surma in newborn baby's eyes? No. The newborn should not apply mascara. It may contain poisonous substance, lead. What is the normal weight gain pattern of a newborn? All healthy newborns reduces about 10% of their body weight in the first 7 to 10 days. Weight loss in the first week is due to evaporation of water from the body. By the 14th day of life, children usually regain their birth weight. Weight gain starts after 14 days of life. Every day the child grows 20 to 30 grams of weight. What are the things that look unusual in a newborn but are actually absolutely normal? 1. Red or white vaginal discharge. 2. Forged rash on a body in an otherwise healthy child called cutis marmorata. 3. Small red spots on the body on the 2nd or 3rd day of life called erythema toxicum. It can last up to 2 weeks. 4. A tooth present at birth is called natal tooth. If it is loose, it must be removed. 5. Acne on the face in the newborn period. 6. Red lines on the upper eyelid. 7. Dryness or roughness of scalp skin. 8. Green spots on the back called as Mongolian spot. 9. The hormones of the mother can cause the breast growth of a newborn baby. It will be fixed on its own. Do not try to remove the secretions present inside it by hands. Consult a pediatrician if it becomes hot, red or has pain. Thank you. For more information, read the blog at beingparentsonline.com or download the Being Parents app.